Well, as most clinicians know, fibroids are extremely common. By the time a woman is 50, somewhere between 70 and 80% of women will have fibroids. And the symptoms that those fibroids cause vary from being completely asymptomatic to incredibly disruptive in their quality of life and daily activities. So the standard treatment for bulk-related symptoms due to fibroids is a myomectomy operation, and the majority of those in the United States are performed through an open traditional incision. Laparoscopic and robotic procedures are available. We certainly perform those procedures within our division here in the minimally invasive GYN surgery division at Duke. And those procedures, I think, are done more commonly open because it's technically quite challenging to make the incision into the body of the uterus, shell that fibroid out, and then repair it in a way that is equivalent to the quality of the repair that you do during an open surgery. There's lots of suturing involved, and it takes a fair amount of skill and a fairly substantial learning curve to be able to do that laparoscopically or robotically. Yeah, so recently I performed the very first Acessa ProView procedure here in the state of North Carolina, and we're very excited to offer that to our patients now. This is a laparoscopic procedure that's done with fewer incisions. So there's really just two incisions, one for the laparoscopic camera and then one for a laparoscopic ultrasound probe, and then a puncture wound through which a long needle is placed. And this procedure involves directly placing that ultrasound probe against the body of the uterus. And studies have shown that laparoscopic ultrasound is able to identify many more fibroids than we can identify with conventional imaging, such as transabdominal or transvaginal ultrasound, or even MRI. So we can identify more fibroids with this procedure. Once we've localized and targeted that fibroid, we then take that needle and pass it into the central portion of the myoma, deploy an array of needles and energize them with radiofrequency energy that heats the central part of the myoma and destroys it in real time while we're watching with ultrasound guidance laparoscopically. The advantages are several, one of which is that this is targeted and customized so that we only treat the fibroid. It's very easy with that laparoscopic ultrasound to distinguish myoma from normal surrounding myometrium, so we can be assured that we're not treating anything other than the myoma. Because there's fewer incisions, patients spend less time in recovery. Many patients don't require narcotics postoperatively. They're returned to fully functional status within 3 to 5 days. We have a vast experience within the minimally invasive gynecologic surgery department with complex surgery, and I'm proud of the fact that we're able to address the depth and breadth of a variety of benign gynecologic conditions, some of which are very complicated, through less invasive means and measures. But I think patients are oftentimes surprised that many who come here thinking and seeking a surgical outcome leave having a non-surgical treatment because based on our experience and our diagnostic capabilities, we can offer them something that they hadn't heard about from providers that they've seen before.